Now, GPs are urging women not to ignore the symptoms of PMS or premenstrual syndrome. The figures are startling in that approximately 3/4 of menstruating women experience some form of PMS. So to discuss the issue, we've got women's health expert Dr. Barbara Kearns here and pharmacist Mike Wakeman, who advises women and has some natural help. Barbara, we might start with you. Maybe just explain when this happens.
So in general, this happens in women in the last 2 weeks coming up to the period, or indeed the last week coming up to the period. And as soon as they start to have their period, then these symptoms go away. And that's the most remarkable thing. It can be a very severe problem for many women, but once the period starts, the symptoms just disappear.
And what are those symptoms?
Well, it varies, but for some women they're physical, for some women they're psychological, but for many women they're a little bit of both. So some bloating, cramping, breast tenderness for some women, anger, anxiety, depression for some other women, and for some women a little bit of both. But there are other symptoms as well.
And is it a case that there's no across-the-board symptom? It can be a variation of any of them?
It can be a variation of any of them, and in different months different women will experience different symptoms, cravings for certain foods, etc., that may in fact make the whole symptoms worse.
Right. And Mike, you're a pharmacist. Do you have people coming into pharmacies with symptoms saying, help me?
Very much so, because very often, as Barbara said, the symptoms are not particularly well appreciated in general practice, basically. And so people very often seek self-medication relief for the symptoms of PMS.
And Barbara, people who do go into the GP, do you see many people going in with it, or how are they treated?
I suppose I'm a female GP, so I probably would be more empathetic to women who come into me and appreciate that what they're experiencing is real and they do need help and advice with it. But I would certainly start with first lifestyle, talking to them about the benefit of regular exercise, eating a healthy diet, avoiding excessive caffeine, and then if that's not working, certainly there's other products such as krill oil, which is very helpful. And indeed, when people are very severe symptoms, we use other prescription medication as well.
And people are sometimes prescribed the pill. I mean, is that a good thing or a bad thing?
It actually quite works very well for PMS, but it's only suitable for a certain age range of women and women who don't have problems with migraines or don't have problems with blood clots. So pill isn't a panacea, it isn't the answer for every woman. So we also use antidepressant medication in some women for a short period of time, just during the 2 weeks coming up to the period, and for other women we use hormonal treatments, a type of HRT, but not as HRT, not as hormone replacement therapy as we understand it, but to reduce the symptoms of PMS.
So Mike, to avoid using the typical medication, if you like, you've developed a product that is more natural, is that it?
Absolutely, yes. I was involved in the development of Cleanmarine for women. Basically, it's based upon a scientific search of the literature. I've been involved in research into premenstrual syndrome for about 30 years now, and I was very aware of the role of essential fatty acids. There's some new research that demonstrates that omega-3 fatty acids, in fact, are beneficial. Lots of people know about evening primrose oil, but few people are aware of the benefits of omega-3 fatty acids. And we looked at the benefits for krill oil, and it seems as though krill oil is very beneficial in terms of relieving a lot of the symptoms of PMS.
You might tell us what krill oil is.
Krill is a small crustacean that lives in the Antarctic. It's a very sustainable source of omega-3 fatty acids. We're all aware that fisheries are being overfished at the moment, and people are concerned about environmental pressures on fish, and so this provides a sustainable alternative to fish oil. It's a very rich source of omega-3 fatty acids, and it's also the omega-3 fatty acids are also presented to the body in a way that the body can assimilate more easily than the omega-3 fatty acids that are present in fish oil. But with Cleanmarine for women, what I did was searched the literature and included other ingredients such as B vitamins, soya isoflavones, vitamin D and rosemary, which helps to improve mood, and put it all together in a single capsule that women can take twice a day throughout the whole of the monthly cycle, basically. And we did a clinical trial to find out the benefits of that intervention in women who had PMS.
And how did that?
It was amazing.
Yeah.
We looked at the improvement over 3 months. So all the women were PMS sufferers. They weren't taking medication prior to the commencement of the trial. There was a 45% overall improvement in all of the symptoms of PMS, but things like breast tenderness, for example, we had an 80% improvement. The women continued to improve throughout the 3 months of the trial, and the interesting thing was that the women who experienced, as Barbara said, the symptoms, the worst symptoms that they were experiencing, experienced most benefit in terms of the relief of those symptoms.
And Barbara, as a GP, would you be much more happier prescribing or suggesting people go and buy these natural products?
Absolutely. I memean, I'm a big fan of omega-3s, always have been, because they benefit your joint, cardiovascular, from heart health. It reduces your risk of Alzheimer's, children with autism, bipolar disease. Omega-3s help. So this is a win-win for you on many fronts. But if they also help, and they have been shown significantly in this study, to help in PMS symptoms, then I think all women should be taking them.
All right, okay. Just give us the name of the product.
It's Cleanmarine for Women.
Cleanmarine for Women.
Thank you.
Okay, Barbara, Mike, thank you very much.
Thank you.
Thank you. Now,